citizens found without mask or not following the COVID-19 prevention guidelines at public places in Gwalior, India will have to work as volunteers in hospitals and police check posts for 3 days.
Here's a summary of the article.
By PTI. Gwalior, citizens found without mask or not following the COVID-19 prevention guidelines at public places in Gwalior will have to work as volunteers in hospitals and police check posts for 3 days, an official said on Monday. Fines would also be imposed on those violating the COVID-19 protocols, he said. An order of this effect was issued by the district administration in Madhya Pradesh on Sunday after Collector Kaushlendra Vikram Singh held a meeting with officials concerned on the ongoing Kill Corona campaign, he said. Follow COVID-19 live updates here. The order said those found without mask or not following the coronavirus guidelines at public places will not only have to pay a fine, but they would also have to work as volunteers for 3 days in hospitals and fever clinics treating COVID-19 patients and at the police check posts. The collector said in the meeting that those coming from Indore, Bhopal and other states should be strictly screened at the district's borders, the official said. The Madhya Pradesh government has undertaken the Kill Corona campaign across the state for a door-to-door survey to identify COVID-19 patients. On Sunday, Gwalior reported 51 COVID-19 cases, taking the district's tally to 528.
This post received a score of 49,000, with an upvote ratio of 94%. Here are the top comments in response to this article.
Volunteers.
Voluntold.
You laugh, but I did high school in Ottawa, Canada in 2002-ish. A requirement to graduate was 40 hours of voluntary community service. I wrote an English paper in grade 11 about how mandatory voluntary work was not voluntary. Got an A. Nothing changed.
Hey, I was in high school around the same time, also in Ontario. I know all too well about the community service requirement. I don't think they ever used the word voluntary though, at least to me. It was simply, you must do 40 hours of community service before graduation, but I do see where you're coming from. I forged most of my hours lol. I got lucky, to be honest. Turns out my English teacher also volunteered for a local community outreach program. All I had to do was tag along for a couple of weekends and that was it.
Will they have to wear a mask at the hospital and check posts? I mean, maybe staffing your essential workers with people that don't follow safety precautions, isn't the best idea?
Hospitals have a lot of awful jobs they don't have to involve patient contact. For example, you could have them in a room in the basement cleaning piss shit and vomit from bedpans and hospital laundry. Or carting bodies to the morgue. Additionally, just explain that if they don't take safety precautions seriously, they won't be going home in the evening and instead will get locked in a cell overnight. Plus, just the threat of this will be highly effective. I very much doubt many people will end up being put through it.
They could just clean the hospital grounds, landscaping as well. Lots of things. They aren't going to be in the hospital rooms helping the doctors.
They shouldn't be anywhere near a hospital, honestly. Have them pick up trash somewhere the fuck away from the people they're not listening to.
I think part of it is making them witness what's going on.
I don't know much about Indian culture, but if that punishment was implemented in a lot of places in the US it wouldn't go great. There would be absolute garbage people intentionally taking their masks off and cawing on people out of spite. Have them handle moving the bodies and digging graves. Little risk for them infecting anyone other than themselves.
Why give the hospital workers and police children to babysit?
The tiny period in your comment made me think I had a dead pixel for a good 30 seconds.
Sorry for your distress. It was an accident.
It's fine.
I appreciate your forgiveness.
That's fucking brilliant.
No, it isn't. I work in a hospital. The last thing I would want is a bunch of anti-maskers there, holy shit. Now they'll catch the disease when they're at the hospital, and spread it when they're not at the hospital since they don't like wearing masks.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.